The psychological conflict associated with homosexuality often arises from a combination of internal and external factors. These conflicts can manifest in different ways depending on an individual's unique experiences, cultural context, and societal environment. Some of the key psychological conflicts that may arise for individuals who identify as homosexual include 1. Internalized homophobia. Conflict. Many individuals struggle with accepting their sexual orientation due to negative societal attitudes toward homosexuality. Internalized homophobia occurs when a person internalizes society's prejudices and believes that their sexual orientation is wrong or immoral. This can lead to feelings of shame, guilt, or self-loathing. Impact. This conflict can hinder personal growth and contribute to issues like low self-esteem, anxiety, depression, and difficulty forming healthy relationships. 2. Identity and self-acceptance. Conflict. Homosexual individuals may experience confusion or internal struggle as they navigate their sexual identity. In cultures where heterosexuality is seen as the norm, they may feel pressure to suppress or deny their true sexual orientation, leading to an ongoing conflict between who they truly are and the identity they are expected to project. Impact. This conflict can delay or complicate the process of self-acceptance, which is crucial for mental health and overall psychological well-being. 3. Fear of rejection and social stigma. Conflict. Many homosexual individuals fear rejection from family, friends, and society at large due to negative stereotypes and discriminatory attitudes. The fear of being ostracized or facing hostility can create significant psychological distress. Impact. This fear can lead to social isolation, anxiety, and depression. In some cases, individuals may conceal their sexual orientation or engage in passing, acting as heterosexual, which can exacerbate feelings of alienation. 4. Cultural and religious conflicts. Conflict. For individuals raised in cultures or religions that view homosexuality as immoral or sinful, the psychological conflict can be particularly intense. They may experience a struggle between their religious or cultural beliefs and their sexual orientation. Impact. This conflict can lead to feelings of guilt, shame, and spiritual distress. It may also result in an individual seeking therapy or counseling to reconcile their sexual orientation with their faith or cultural identity. 5. Family dynamics. Conflict. The prospect of coming out to family members can create significant psychological turmoil, especially if the family is unsupportive or hostile. The individual may fear damaging relationships, losing emotional support, or facing rejection from loved ones. Impact. This conflict often leads to a struggle between the desire for acceptance from family and the need to live authentically. If family members react negatively, it can lead to deep emotional pain and mental health challenges. 6. Coping with discrimination and violence. Conflict. Homosexual individuals may experience discrimination, bullying, or even physical violence because of their sexual orientation. This external conflict creates ongoing stress and trauma that can lead to long-term psychological damage. Impact. Exposure to such experiences can lead to heightened levels of anxiety, depression, PTSD, and feelings of helplessness or worthlessness. 7. Impact of heteronormative expectations. Conflict. Societal expectations around relationships, marriage, and gender roles are often rooted in a heterosexual norm. For a homosexual individual, the pressure to conform to these expectations can create a sense of conflict and frustration. Impact. The individual may struggle to meet these societal standards, feeling alienated or marginalized. This can affect their relationships with others and their own sense of belonging.